Tepezza is a prescription medicine used to treat TED, no matter if you've had TED for months or years. Tepezza may cause infusion reactions. Tell your doctor right away if you have high blood pressure, fast heartbeat, redness of the face or feeling hot, difficulty breathing, headache, or muscle pain. Please stay tuned for additional important safety information later in this video.
I feel as though Tepezza is one more medication that I have in my arsenal to bring good quality of care to my patients. My name's Sonalika Khachikian. I'm an endocrinologist. Thyroid eye disease isn't new. In the past, I really haven't had too many tools to be able to treat patients. In terms of how I try to determine whether a patient is a candidate for Tepezza or not, I'm doing a physical exam. One of the things I look for is if they have something that we call proptosis, which is bulging of the eye. Across all the clinical trials, the medication has shown statistical significance to help with proptosis. Before I start a patient on Tepezza, it's really important in my mind to go over any potential side effects. And it's our job as providers to attach the right treatment option with the patients. One of the other things I counsel my patients about is the importance of making sure that they stick to the schedule. Building a rapport with patients is very important. You know, I usually start off my visits just asking patients what's going on, how things are going, if they have anything on their mind. And I think it opens up a really good floodgate. I find so many things out about people that sometimes they wouldn't think is important to share with me. I think in my area of specialty, I'm really lucky because I get to build a relationship with patients. The more they can open up to me, the better I can do my job. It's a total of 8 infusions given 3 weeks apart. It's important for them to complete all 8 infusions to see the full benefit of the medication. After my patients have completed their Tepezza treatment, I've noticed when they've come into the office that clinically they don't have as much bulging of their eyes or proptosis. And I always ask them at the end, I say, now if you were to look back and you were to tell a friend, would you do it again? And I think 9 times out of 10, my patients say, yes, I would tell my friends to go down the route of this medication. What motivates me to continue to treat patients with thyroid eye disease is the majority of my patients benefit from Tepezza.
Important safety information. What is the most important information I should know about Tepezza? Infusion reactions can happen during or within 24 hours after your infusion of Tepezza. If you have a reaction while receiving Tepezza, your doctor or nurse will slow or stop your infusion and treat your reaction. If you have a severe infusion reaction, your doctor may stop your treatment completely. Tell your doctor or nurse right away if you have any of these symptoms during or after your treatment with Tepezza. High blood pressure, difficulty breathing, fast heartbeat, headache, redness of the face, feeling hot, muscle pain. Tepezza may worsen inflammatory bowel disease, IBD, such as Crohn's disease or ulcerative colitis, even if you don't have a diagnosis of IBD before starting Tepezza treatment. Tell your doctor right away if you have worsening IBD symptoms, which may include diarrhea with stomach pain or cramps, blood in your stools, sudden urgency to have a bowel movement, or feeling like you need to have a bowel movement even when there's little or no stool to pass. Tepezza may cause an increase in your blood sugar. Before starting treatment with Tepezza, tell your doctor if you are currently being treated for diabetes, know your blood sugar is high, or have been diagnosed with diabetes. It is important for you to take your treatments and follow an appropriate diet for glucose control as prescribed by your doctor. Tepezza may cause severe hearing problems, including hearing loss, which in some cases may be permanent. Tell your doctor if you have any signs or symptoms of hearing problems or changes in hearing. Before receiving Tepezza, tell your doctor if you have inflammatory bowel disease, Crohn's disease or ulcerative colitis, are currently being treated for diabetes, have been diagnosed with diabetes, or know your blood sugar is high, are pregnant or plan to become pregnant. Tepezza may harm your unborn baby. Tell your doctor if you become pregnant or suspect you are pregnant during treatment with Tepezza. Women who are able to become pregnant should use an effective form of birth control, contraception, prior to starting treatment, during treatment, and for at least 6 months after the final dose of Tepezza. Are breastfeeding or plan to breastfeed? It is not known if Tepezza passes into your breast milk. Talk to your doctor about the best ways to feed your baby during treatment with Tepezza. Tell your doctor about all the medicines you take, including prescription and over-the-counter medicines, vitamins, dietary, and herbal supplements. Know the medicines you take. Keep a list of them to show your doctor and pharmacist when you get a new medicine. What are the possible side effects of Tepezza? The most common side effects of Tepezza include muscle cramps or spasms, nausea, hair loss, diarrhea, feeling tired, high blood sugar, hearing problems, taste changes, headache, dry skin, ear discomfort, weight loss, nail problems, and changes in menstruation. This is not a complete list of all possible side effects. Tell your doctor or treatment team about any side effect you may have. You are encouraged to report negative side effects of prescription drugs to the FDA. Visit www.fda.gov/safety/medwatch or call 1-800-FDA-1088. Please see full prescribing information or visit Tepezza.com for more information. Talk to your doctor to see if Tepezza could be right for you.